So no one should suffer with pain. When we talk about pain in medicine, any patient or anyone coming with pain has some reason, like any broken bone or infection or any other issue. But somehow it's become quite common for a woman to suffer pain during her periods. But is it the normal, or is there any reason? I am Dr. Sunil Eshwar. I am a consultant laparoscopic surgeon, infertility specialist at Aikya Fertility and Research Center and Aster RV. Today we are going to talk about the pain during periods, which is also called as dysmenorrhea. We have with us our one patient who has gone through this ordeal and who feels that she needs to tell her story to all of you to know what is normal and what is abnormal. Mrs. Chaitra, hi. Welcome to the talk.
Yeah,
I would just want you to introduce yourself.
Hi, I am Chaitra. I am from India, and since 8 years I am in US, staying in New Jersey. So I have a daughter of 9 years old who was born in India. After that I moved to US, and beginning everything, like before my first pregnancy, everything was okay. It was like a normal periods. After that, like my first child, after a year, slowly every month I could see a difference, like it is little hurting, and I thought like when I'm talking to my parents or someone, like after delivery some changes happen, so maybe then that kept on increasing every month. And after 2 years it was like too much, like I could feel like it is something not normal. The pain was to that extent where like that 3 days it is like I'll be like horrified to like let me pass.
So
like,
you don't want periods to start.
I don't want, like I'll be just checking on the calendar, and when it is about 10 days to start, I used to literally, not even me, like with me around, my husband, my daughter, everyone like panicked. Oh, my mom is getting some like problem. So this was the scene, and after 3 to 4 years it was really bad. And every month it is like too much of pain. The 3 days, the pain, I can tell you, like I forgot. I had my first baby through a like normal pregnancy, normal delivery, where you had helped it. So I totally forgot what is a labor pain in front of this pain. It was to that extent. For me till today, if what is pain, this is the pain I can recall. So it was too bad, and the bleeding was high.
Thing is, people say the worst pain anyone can undergo is a labor pain.
No.
So, and you're saying it's worse than the labor pain. Okay.
That's super worse. Like it is 3 times or 4 times, I can tell you. Like you will totally feel that last moment of your delivery where you give birth in the first day itself. So you are continuously going through this pain for 3 days, and to control this pain, I used to take painkiller for every 4 hours, and you won't believe, like if the tablet, if I skip like half an hour more, like more 4.5 hours, the pain used to shoot like anything, and I had to take a tablet. To work, it takes around 15 minutes. I used to literally wait, like when it comes, like in the night time I used to keep an alarm for every 4 hours so that I can wake up and I take a tablet so that it doesn't come.
So your sleep were also disturbed.
And one thing is that, and since we stay outside, we don't have any extended family to support us, and it's only me, my husband and daughter. And along with me, they used to suffer a lot because I am undergoing all this, and they are seeing this, and I had to support my daughter, all this. So it was like with the tablets, I used to like manage that 3 days and relax for 15 days. Again it's back, and it was really horrible. There's too much of bleeding, even with clots.
So you used to pass large amount of clots.
Large
so you must be feeling very tired.
Yeah, like always you feel I should sit in the bathroom. It's more relaxing than lying down. And to control this pain, along with this painkiller, I used to keep hot bags. And it is not one. Usually they keep one hot bag. For me,
so on the front.
I used to keep in the both side, and I used to keep in where we increase the temperature, right? I used to keep it for high. And in these 3 days, I don't even know, like it's too much, and I have a lot of burns. And like after 3 days, when I see what is that something, so in the 3 days I had gone through also.
Yes,
so much.
We have seen this in some patients because they use this hot bag because pain is so much that when they keep this, because the skin getting burned, there, at least the pain is diverted.
Yeah,
It's
and
like,
you know, sir,
yeah.
I used to stand in a hot shower for almost half an hour. Like almost when the hot is going to like changing to cold, then I used to come out. Like I used to totally forget I'm standing in a hot shower. So that cools me down.
Oh,
So
okay.
that was
That may be fine.
it
So
was the,
during this time, did you visit any doctors there? I understand
yeah,
you're in the
yeah,
US, and
yeah.
that's
I
one of.
tried 2, 3 of them, but I couldn't get any like proper solution for this. Like it was like painkillers, or it is like they are just diagnosing.
Did
And
they do any tests like scans or
yeah,
anything?
they did some scan, and they were like, is it a fibroid, or is it adenomyosis? They could not conclude like what it is. Like I
Okay.
couldn't get a solution. That's
Okay.
the
Okay.
end part of
Okay.
it. Yeah.
So, and see, generally when we say about a progressive pain, when you talk about dysmenorrhea or during the, as you rightly said, before your delivery, your periods were pretty normal, and then after delivery it started. This is some of the markers which we say it's a secondary dysmenorrhea. Whenever there is a secondary dysmenorrhea, we say there should be a reason. Either there should be any infection, or there should be a fibroid, or more commonly the way you've been describing, it could be what is called as adenomyosis, or sometimes associated with endometriosis also. The most what literature says is it generally takes around 6 to 8 years for this diagnosis to be made of either an endometriosis or adenomyosis. And as you rightly said, you took
It was
almost like
8 years.
8 years. And in initial stage, actually, if it is diagnosed well, we could manage with some hormonal tablets or some pills, which could, I think we have tried to consider that. But yeah, the only way to diagnose is either by the ultrasound and the clinical symptoms. You can have an MRI also, but many a times it's about your symptoms, your lifestyle. I do understand, because of so much of it, probably even your mental health was getting affected.
It is.
Yeah.
Like it was like total depression. I don't believe in depression. I don't know what is depression. But this, you will literally feel like, why am I a girl? Like, why am I suffering so much? And you know, when one of my friends, they tell like, today is my periods, I used to get panicked. I'm like, oh, you take care, you lie down, you don't do, and they are absolutely normal. And I'm like, how can it be? Like, is something wrong with me? I'm like, many times I have asked my husband, like, is it something major? Like, it is to that extent.
Good. So, and I believe you had contacted us because I had delivered your daughter. So, and I had told you certain investigations and some things like that. But unfortunately, nothing much happened there.
And then COVID happened
and COVID happened, of course.
Yeah, that delayed. Yeah.
So, and then you came to India, and then we had a diagnosis. We diagnosed her to have what's called as adenomyosis, where the uterus is enlarged and there is a
it was almost 2.5 kg.
It was 2.5. Okay, so it was almost 2.5 times of a normal size uterus. And as Chaitra was suffering a lot with pain and her condition was quite advanced, then we had suggested her to undergo what is called as laparoscopic adenomyomectomy, which is a very high-end kind of a surgery which requires lots of expertise and time and instrumentation. We advised that because she was suffering so much of pain, she was so open to do anything and get the pain off. So how was your journey when you talk about surgery? How was your experience as a surgery?
I would like to tell, like, one thing is the pain, and since I stay outside, there the facility is not like that. For everything you have to wait for an appointment. So once, just for a doctor consultation, I have to wait for 1.5 months just to take an appointment, and all it is the delay thing where you are waiting and suffering all this. And that too, like, it was disturbing a lot. But we were thinking, like, we come for short, like 2 months, like when is a vacation. So we were like, in 2 months can I get it done? But once I contacted you, you told once the day you come, you just let me know. So it was like within a week, like, if I tell, it's July 3rd I landed in India, July 5th I had his consultation, July 7th was my surgery, July 10th I was discharged happily. So it was so quick, and it's such a relief. And when I saw him, I knew, like, I'm in a right hand and everything will be okay, and everything is okay.
So you mean to say within a week?
Within a week, my 8-year problem I got a solution. Yeah.
So we back then also had a consultation
Yes.
telephone, I think. We
Yeah,
had
I
a-
used to contact
Yeah,
you.
so we had
and-
told about the schedule, how it would be. So
Yes,
you were
yes.
prepared
I
for
was
it.
prepared for
Yeah,
it.
so
Yeah.
that's another thing. We also do a online consultation, so which you
Yeah.
could solve it. We had because
And,
I understand US tickets are quite costly coming down, staying
Yeah.
here and all this thing. But then yeah, we did it. So after surgery, how many days it took for you to get back to your normal routine work of
Yeah,
taking care of
like
child?
within 2 days I was discharged from the hospital, and within a week I was like totally okay, like normal. Just rest for 4 to 5 days, and I was okay. I could travel, or like
Oh, you traveled?
Yeah,
Where
I
did you go?
traveled to my native,
Oh,
and it
that's
is around 6 hours from here
Kurg.
to
Huh?
Kurg. Yeah.
Oh, okay.
So after that, like I didn't even feel like I went through a surgery. Like it was so cool. And after that 3-4 months, because you told me like let us pause for a few months so that you get a rest for a uterus, like let it not bleed. And after that, my normal, like exactly you had told me this date you will be getting your periods. Just a day before that day I got my periods.
Okay.
So it was so perfect. And every month it was perfectly going. From 6-7 months I'm getting my periods, and it is like it's zero pain, and I am just thinking like I am a teenager now, like just started my periods. I'm so happy now.
So you got your life back.
I got my life back. I got a rebirth actually. And it's like my whole family is happy, my daughter is happy, my husband is happy, because it's a big life, like so total gift for everyone now in the house after this surgery.
So this surgery is very simple surgery. It's called laparoscopic adenomyosis. We generally have few keyhole surgeries, keyhole incisions, and through that we dissect the uterus. There are challenges. Considering adenomyosis, there will be lots of bowel or intestine getting adherent, and blood flow is more. We need to optimize that.
And sir, if you remember, with my surgery, you had told me like it was like to my intestine, everything was like.
Generally, it is like that. The intestines are adherent. After the surgery, we also put them on injections to make sure that they don't get period for 3 to 6 months, depending upon how much we have exercised. And after 6 months or 3 months, we just give a trial to see how we are getting your periods. If it's painless, then nothing much to worry. We've also done your scans, follow-up scans, which is like, as you said, it was 2.5 times increased in size. Now, as it is totally a normal size. And I did not know that she also traveled, but we keep telling that it's okay to do normal things. Keyhole surgeries, you don't have to really take long rest, and that's the advantage of it. Another advantage of it: less infection, less bleeding, and then you can get back to your normal life. Imagine if you've done like a cesarean section, a huge incision. Considering you have to go back to your native and also to the US, you would have taken a longer time to recover. Like
one more thing, like there when I was like in this 8 years I had consulted like 2-3 doctors. So there, like whatever such solution they were giving is like it was just you have to remove your uterus, or the tubes, like tubes would be removed. And a doctor, he told laparoscopically this is not possible, we have to go through the open surgery, and that is the only solution, he told. Then I took a call back, like he gave me an option, but I told no. But he had told like if you don't go for an open surgery, it's not gonna happen, because it's almost a football size. When we talk about women's health, hysterectomy is not the only option, because I keep hearing many a times my patients, even in fact yesterday, a patient walked in with almost like 6 to 7 fibroids in her uterus. She was 40 years old. So most of them have suggested her to undergo hysterectomy. Not necessarily hysterectomy is the only choice. Yes, we will have to look at conservative managements and conservative surgeries like adenomyoectomy or myomectomy, which requires more of skills, and also my patient to understand that there is a chance of recurrence. In you also we told you that we will be doing this, but there is a chance of a recurrence. 5-10% of recurrence over a period of 5 years can happen. But when we talk about the surgery, we also plan your life ahead. Like say, okay, now you are 37, 35, now we are doing this surgery.
So this is this what will happen till 40. This can be this. That 45 this will be this. So if you can plan you and show you your next few years how it's going to be, maybe that makes the decisions easier, right?
Yes. Yeah, just like this hysterectomy is the only solution, and you don't have other, like if it is, you will be blanked out, like we don't know how is the next step, like if you think this age, what, like is it okay to get it done, and is it the only solution, don't we have other a few doctors, I didn't even get another answer, like I had informed you this before, like they told like if you remove the uterus, that's the only solution, or else it's not. But today my uterus is safe and everything is
You're having
fine.
periods, yeah. So what I would like to tell everyone is, yes, there are options, multiple options which you need to discuss. Also, we need to discuss as to what is the outcome of each of these options, be it medical management, be it like conservative surgery like adenomyoectomy or myomectomy, and what is the chance of recurrence, how your life is going to be, and how you could help yourself with your lifestyle, natural things, diet, weight loss, how it can impact your future reproductive health. Yes, I think Chaitra has shared most of it. If anything else you want to add?
Yeah, I would to just thank him. He gave me a rebirth actually. It is not just to tell, like it is actually, because I felt it, because this 8 years, suffering for 8 years with such a bad pain is not so easy now, because when I'm saying it is so easy, then I'm like, he helped me a lot. Even though I was staying there, just through some WhatsApp or something, he used to respond to me anytime, like even if it is because we have a difference, but still I used to get the reply within, like this is the thing, do this, do that. So he supported me online through, and after when I came, everything was smooth, and thank you so much, sir.
Thank you. Yeah, that's the message we want to tell, that you don't have to suffer with your pain, and the pain during periods or pain during your reproductive life can be treated. There are options, and please, anything is there, you can get back to us. Thank you so much. Thank you, madam. Thank you so much.
Thank you.